Hello and welcome to the DIana Falzone Show here on Pal Talk. Hope you guys are all doing great. I know the summertime is the time where you want to get in your best optimal shape ever. We're not just talking about your body, but your skin as well. So we have brought in the owner of Fountain Medical Group and Spa, Dr. Todd Schlifstein. And you guys could check him out on Facebook at Fountain Medical Group. And also, are you on Twitter?
Yes.
Oh, wow. Everybody's on Twitter. Everyone's got to be tweeting out to Fountain Medical Group and also online, fountainmedicalgroup.com, correct?
Yes.
So you have told me about some new scientific findings on skin, and it's something that was being done in orthopedics, and you obviously are a sports physician first and foremost.
Right. So first and foremost, I treat orthopedic or sports medicine injuries. Mm-hmm. So PRP, which is what it's called, is platelet-rich plasma, was originally used for surgery or orthopedic injuries to help injuries heal. For example, it became very popular a few years ago when Hines Ward from the Pittsburgh Steelers had a ligament injury. It was a partial tear, and 2 weeks later he was playing in the Super Bowl. Wow. How is that possible? Well, he had PRP injection, which helps it heal faster. So what is PRP? PRP is essentially, we take a sample of your blood, we spin the blood down, which separates the blood into its components. So it sounds pretty odd, yeah, but it's what we're doing is we're taking and filtering out the platelets. Now, we take that platelets and inject it into the site of injury, and what happens is the platelets contain all your healing, growth factors, fibroblasts, fibrin factors, thrombin factors, and helps the tissue heal. Wow. So a ligament or a tendon that doesn't have any blood supply normally wouldn't heal without surgery or scarring up and resting it. So to accelerate that process or to avoid surgery, we're taking your components of your own blood in super high concentrations of growth factors from yourself and putting it into the site of injury, so it accelerates the healing process dramatically. So you have 5 times the concentration of healing and growth factors all in one spot, and you accelerate the healing process. Now, it works very well for that, tendon injuries, ligament injuries, things of that nature. And there are several, big sports players who have done this and recovered remarkably fast, so it's gotten a lot of press. Now, that technology or that thought process has been extrapolated even further, which is kind of even interesting, where it goes to what we call the vampire facelift, which is
that's true bloodish.
Yeah, like a real, but it is kind of like a vampire facelift, because essentially we're doing the same thing. We take your blood, we spin it down in a centrifuge, which separates out the components. We take out the platelets and growth factors, and then we use it on your face. Now, we can do it in 2 different ways. We can do it, we can inject it into fine lines or wrinkles or scars, so it helps the dermis and subdermal tissues actually heal. Or we can actually spray the blood onto the face, which has all the growth factors that you would have, and it helps rejuvenate your entire skin. Right. And over the next 2 to 4 weeks, the skin looks totally brand new and fresh because it's all healed, fresh, new skin.
So you spray blood on someone's face?
Yes, yes. So that can be done with injecting it or spraying it or both.
So someone's going to look like they're a murder scene.
It looks pretty dramatic. Yeah, it sounds pretty crazy.
That's like, you get post-traumatic stress disorder from this.
Yeah, but it's actually, the science behind it makes a lot of sense, because you're helping yourself heal itself faster and more dramatically and localized. So there's no drug, there's no chemical, it's just helping yourself heal itself. Okay. And you're going into your dermis. Why? Your dermis could have damage to your skin, to your skin's elasticity, your fibroblasts, your collagen, sun damage that you don't see, that you only see in ultraviolet light. Isn't why you don't see it? Because it's under your skin, deep in the dermis, so you don't see it. Right. So it can help heal those type of damages to your skin, help stimulate tightening of your skin by making more collagen, which over time you make less and less of, and it breaks down quicker.
And that's how people have a sagging face or any of those imperfections.
A lot of celebrities have come out and said that they've done this on several websites. You've seen that from Angelina Jolie to...
She's done it. Well, Angelina Jolie loves anything that has blood splattered.
Yeah,
She must be
yeah,
excited
so-
when she has her monthly visitor. I mean, honestly, she likes blood a lot.
Not that did she need it beforehand, or is she just preventing it from aging, so there's questions on that, but certainly I think the science behind it makes sense, and from the results I've personally seen, it seems dramatically helpful, yes.
My question with the vampire facial is it a preventative measure so that people don't need a facelift? Will this replace the actual nip and tuck of going to a plastic surgeon when you're, say, 50 or 60 years old?
Well, I think it definitely might delay the process, or if you do it regularly, would it prevent it? Yeah, possibly. No one's looked that far into the future,
Right.
but I think if you're doing more things to prevent it, then certainly you would need a lot less of that later on. If you still would have collagen and elastin and tight skin and it's not sagging, then certainly you wouldn't need to have that repaired later.
Is this going to take care of Botox? Is this going to take Botox off the market?
It can work for finer lines, but some deeper lines or crinkles or creases, it probably won't work for that. So I think it's something in addition to, and not in replace of. And certainly in people who are younger, meaning 30, 40, 50s, it probably works a lot better. Why? Because you have more growth factors in your blood and healing factors than you do when you're 70. Yeah, you may not have the same healing potential as someone who's in their 30s.
Who is the best candidate for a vampire facial?
I think people who have some sun-damaged skin, some fine lines that they really just don't want to fill in, or areas that really aren't amenable to Botox, or have sun damage, or skin that's losing its elasticity, or hanging or sagging just a little bit earlier on. I think those people are excellent candidates, so 30s and 40s. So they'll get more dramatic results and prevent future problems, and maybe won't need to have a filler to fill in those lines, or Botox to tighten those lines, because that may do enough on its own. Plus it just keeps your skin look so much fresher and newer because it's all regenerated and healed on its own.
Wow.
So a lot of future medical technology is probably going to be based on things like that. Yeah, certainly. They're just like taking bone marrow cells from someone and making their own stem cells to regenerate their cartilage.
Well, is this
or that technology, I think, of bioactive, which means using something from and to help it heal itself, or from yourself to repair itself.
Does this get into that slippery slope of using stem cells and stem cell research, and are people in the medical community, and maybe even outside, just people like our Pal Talk viewers,
Right.
Is the vampire facial kind of on that slippery slope of, well, you're using your own material and your own tissue, are people going to be against this, saying like, we're not guinea pigs for science? What do you think about that argument?
I mean, they can certainly say that, and they don't want to do that.
Right.
But I think the science on it is just beginning. But I think the science makes sense, because if you can help yourself heal yourself, then why wouldn't you do so? It may seem a little extreme because it's blood, but it's your own blood. So there's no drug, there's no chemical, there's no foreign product that we're doing yourself. So if we can help you heal yourself and not give you anything else artificial, I think there's a lot to say for that. And certainly, when it comes to tendon injuries, if I could inject your blood into your tendons, to avoid having surgery and pins and screws, I think that's certainly a huge advancement in medicine.
Right.
And I think a lot of future potential things could do from that. Like they're trying to regrow cartilage. If someone has a cartilage injury, you're trying to regrow discs in their spine, which really there's no real great treatments for that. So I think the potential for that is really kind of exciting, and a whole new field of medicine, of non-pharmaceutical, non-surgical medicine is pretty exciting. So it's less invasive.
And you can stop people from having years and years and years of suffering with pain, because any kind of degenerative disc issue you have or disease is extremely painful. I mean, I dropped a coffee can on my foot, a giant coffee can from Costco, from a distance. It fell right on the top of my foot 2 years ago, and I fractured it, and the podiatrist said I had some nerve damage. And I'm telling you, this foot, the past couple of days, I just have tingling, like tingling as if my foot falls asleep all day long. And I'm like, wow, is this something I'm going to have to deal with? day in and day out for the rest of my life because I dropped a stupid coffee can. And that's minimal comparatively to people who have, like you said, tendon injuries, ligament injuries, or athletes who depend upon their living for being fully functioning human, really just like human specimens for their job.
No, definitely, because they did a study on European soccer players. They had ligament injuries, and the ligament injury usually kept them sidelined from 6 to 8 weeks. They did the PRP injections, and they're out from 2 to 4 weeks.
Wow.
And for those guys who are making literally millions of dollars per game, if you're getting them back in half the amount of time and not doing surgery, I mean, that's tremendous. You know, obviously that's an elite athlete, but certainly that shows you the potential for things like this. I mean, it's widely, dramatically improving.
For the people who are just joining us right now and asking, what is this? This is the DIana Falzone Show here on Pal Talk, and my special guest is Dr. Todd from the Fountain Medical Group, and we're discussing all the new advancements going on in the medical field, but specifically in terms of skin and beauty. So we have the vampire facial, which is something that I'll have to flip a coin and see if I'm brave and try it one day. I don't know. But what are some of the other things we're seeing in cosmetology and estheticians and all that?
Well, I think a lot of things are on, like, you have fillers, which are volume, you have a line, you fill in a line. They have a lot of things now where you inject and it stimulates your body to make its own collagen.
Wow.
So I think that's why.
Where do you inject it?
Into areas where you would need it. If areas sagging or falling, instead of filling it in, you want to stimulate it to tighten up on its own. So these like bioactive substances or substances you take from yourself, I think is the kind of the wave of a lot of different types of things, especially in cosmetics and dermatology and plastics. It helps things heal faster, stimulate your body to help heal itself. Which also, if you're doing it that way, it tends to look a lot more natural than artificial. You know? You can only fill in so much of a filler without it looking like you weren't filled in. You know? So you're adding volume. So if you can help your body heal itself, I think that makes a lot of sense, and it's certainly a lot more natural. You got to get past some of the other parts of it. Yeah, it does sound pretty dramatic, but if you think about the science behind it, I think it makes a lot of sense to a lot of people. You get past it, but it's blood, yeah, but it's your own blood, you know, and
I'm sorry. Is there any way that you could be allergic?
Well, just your own blood.
So you couldn't. So if you re-inject it, you wouldn't have any kind of.
It's your own blood
issue.
You know, there's nothing else mixed with it. There's no other chemicals. We're just isolating a certain component from your blood and giving it in much higher concentrations than normal to areas that may not get it. And may accelerate healing of it by injecting it. So we're actually stimulating a little inflammatory process. So you feel a little swollen, you may look a little red, which we want.
Right.
When it's inflamed, then the platelets release all those healing and growth factors, and then it stimulates the process.
Now, so how long would this sort of injection, bioactive injection, last?
Benefits seem to last a year or maybe even more, depending on your age, and also depending on how much damage there was, but certainly it could last that long, because as we do the injection, it's still going to be improving. 4 weeks later, it's still showing levels of improvement, because all those growth factors are stimulating healing processes which take weeks to occur. And then it's stimulating your body to produce and develop collagen to help tighten your skin, to help support your skin, so your skin appears tighter. The skin itself feels healthier. Little finer lines are kind of smoothed out because the skin is tighter. Usually those fine lines are formed from collagen breaking down, from sun damage, from age, or just from the skin losing its elasticity because it loses collagen over time.
Right. Now, when you talk about synthetics, and are there any synthetics right now that are just the way of the past, and people and medical experts are saying they're not to be used anymore, they're kind of passe? Like, what are there any that they're just not being used as much?
No, I think the use of like Botox is probably higher than ever. Certainly because of awareness and safety, and people know the benefits of it.
I just had a friend going for Botox for migraines and sweating problems. So Botox kind of has a lot of different side effects.
So many different uses for it. I mean, it works great for migraines. It works great for spasticity, for spastic bladder.
Really? You Botox the bladder? I need Botox in my bladder. It's not a joke. Like, I literally can be on a plane for a 6-hour trip and I'm up like every hour and a half. I don't know if that's normal, but same thing with sleeping. I didn't know. So explain what you do with Botox in the bladder, because now I'm intrigued.
Bladder's a muscle, right? So
yeah.
the muscle, if it's spastic or tight, it's not going to fill up much. If it relaxes, it's going to fill and be able to handle more volume. If it's very spastic, or then it won't hold much, but it also makes you have an urgency sooner. By relaxing, you take away some of that urgency, and you can control exactly how much you're relaxing by how much you give. So for urology, for people who have spastic bladder or a very small bladder, it can help them relax, so they have a larger volume and less urgency. For migraines, it has properties where it blocks certain pain.
Wow.
It certainly blocks certain pain or spasticity because it's a muscle relaxant. For hyperhidrosis or excessive sweating, like armpits or palms.
Ocean hands.
So what it does is it basically shrinks up those glands for 3 to 4 months and prevents you from sweating in those areas. And for some people, that's a problem. It can be, if it's really excessive, it can really be a problem.
Oh,
It can
yeah.
be irritating socially, as well as affecting your skin can be irritating,
Right.
but it's only a good treatment for a lot of people that way.
Quick question. With those kinds of usages, I remember going to school with a kid who they made fun of and they called him Ocean Hands, and
Right.
he was so embarrassed and was horrible. Is there an age where Botox can be used? If a child has excessive sweating, can you use that on a child?
Certainly you could. Always caution has to be taken because it is relaxing your muscles, so you don't want to do too much and have weak hands.
Yes.
And there's some topical stuff to use first, and you kind of work your way up the progression until you do that.
Right. Is that the same thing with the bladder? How there's all those pills that say, here, try the pill first before you go in and inject?
Absolutely.
Yeah.
There's things that are muscle relaxants that are specific just for your bladder, so your bladder does just relax, so it's not spastic and has a small volume, so it doesn't make you want to urgency of go all the time. Right.
Yeah. No, that's interesting. Now, in terms of facials or things like that are just traditional, what do you recommend for somebody, let's say in their 20s? What is a good facial that they can use that just keeps their skin healthy and continuing to age well?
Well, I think certainly someone in their 20s, they may not need a facial, but I think it's always good to have a good cleansing facial. Depending on their particular problems, then, do they want to have a light peel or just exfoliation or just really a good cleansing facial to open your pores, clean your pores, and allow your skin to kind of heal itself to prevent it from getting clogged or scarred or, and help it keep it clean and healthy. If you have other type of problems between pigmentation or acne scars, staying on top of it, is helpful. If you wait longer and longer, it gets harder and harder to do things for that. So certainly, if you do something like that, then there's different types of peels and other things that can be done, or even laser treatments to help remove scars, tighten skin, tighten pores, and things of that nature. I think most people could benefit from a facial. You want to keep their skin fresh and clean, hydrate your skin, take care of it, and certainly it's the clothes you wear every day. Essentially, your face is, your face.
That's why
so it's your calling card, so it's really, you should, extra care and caution. It's certainly worth a little investment into it, absolutely.
Yeah, I think people spend a lot of money on their hair. For women, they know that. And then, too, with all the ways to keep your hair, I think your skin is the primary, most important thing that you need to take care of in your life.
Right, and certainly if people spend a lot of money on skincare products, if you're spending that much money on a skincare product, then you can certainly spend some money on a facial.
Right.
And then get directed on what products really are good for you, what products you really need, or which products are really fluff, meaning it makes your skin look better, but is it really helping your skin? Right.
Is there any kind of repair? And one product that you wholeheartedly endorse is Skin Medica.
Right.
And that's something that you could even look into and purchase on your website, ThoughtMedicalGroup.com.
Right.
With that, would you recommend someone seeing an esthetician first and knowing what their skin type and combo is, and then getting the right product depending upon that?
Yeah, I think that's always a good idea to find out what your needs really are. And this way you're buying products that really you're going to get the best results from, and what are you looking for? What do you want to get out of from the product? You know, what bothers you the most, and then targeting and using it the proper way. I think it's always good to have guidance with that. And so you're buying products that are appropriate, and also people that are using them appropriately, which sounds simple enough, but it may not be. From cleansing to moisturizing to any type of anti-aging, what age is appropriate for some anti-aging treatments such as retinol or other things of that nature, and getting the most dollar value. I mean, the value of Skinmedica is it's a doctor-only line. It's medically tested and proven to be effective, as opposed to other lines that may make a lot of claims, but certainly don't have scientific studies to back up those claims.
Right.
So they can say whatever they want on the label. It sounds great, but you know, having a scientific study to prove that it's effective is certainly a lot more believable.
Well, thank you for joining us today. I think you've given people insights into the science of beauty, things that I never knew were even possible, or what exactly the reactions were. So thank you for that. And guys, make sure to check out Fountain Medical Group. If you are in the tri-state area, he is based out of New York City and has the top of the top experts, such as himself, there, Dr. Todd, to help all your medical needs, your questions, and to make you look and feel better. So thanks, guys, for joining us. We'll see you real soon here on Pal Talk. Thanks, Dr. Todd.
Thank you.